Welcome to Easy Nurse, where nursing education made easy. In this section, we are discussing about the previous year question paper of community. So let's go through one by one. So here we having the first slide. Give the meaning of the following. So first one, health records. In the word itself, we know that what is health records. We are keeping records of health. So a health record is a confidential compilation of pertinent means important facts of an individual's health history, including all past, present medical condition, illness and treatment, with emphasis on the specific events affecting the patient during the current episode of care. So next one is geriatric nurse. What do you mean by geriatric? Geriatric is a old patient, old meaning that geriatric. So nursing care of the aged patient given in the home, the hospital or the special institutions such as nursing homes, psychiatric institutions, etc. So we are giving care to the old peoples, that is known as geriatric nursing. Next one is emergency contraceptives. What is that? Emergency contraception refers to method of contraception that can be used to prevent pregnancy after sexual intercourse. So these are recommended for use within 5 days but are more effective the sooner they are used after the act of intercourse. If they are taking the medicine after the intercourse, it will be effective. So if they are taking time means it also will be making complications. Okay, next one is rehabilitation nursing. What is that? The rehabilitation nurse is a nurse who specializes in helping people with disabilities and chronic illness attain optimal functions, health and adapt to an altered lifestyle. Rehabilitation of nurse assists patients in their move towards independence by setting realistic goals and treatment plans. They work as a part of a multidisciplinary team and often coordinate patient care and team activities. Sorry. Okay. In the multidisciplinary team, often coordinate patient care and team activities. Next one is rehabilitation nurses facilitate patients with long physical disabilities or chronic diseases, alter their limitations and reach their full potential. So, thus nurses work with patients and their members of the family to make a recovery range and set short and long goals, ultimately serving to the patient succeed a freelance, a way of life as attainable. So, rehabilitation of nursing means we are helping people with those who having disabilities. So, this is the main, actually this is so much big, so you can make your own words. Okay, next one is notification of disease. What is notification of disease? Here we can see that 4 points. The first point is disease notification is a practice of reporting the occurrence of a specific disease or health related condition to the appropriate and designated authority. Second one, a notifiable disease is any disease that is required by a law to be reported to government authorities. Next one, third one. The effective notification allows the authorities to monitor the disease and provides early warning of possible outbreaks. Last point, a notifiable disease is one for whom regular and timely information regarding individual cases is considered necessary for the prevention and control of the disease. So this is the fifth one. Next one, we are moving for the maternal mortality rate. Maternal mortality rate, in the short we can see we can call that MMR, capital MMR. Okay, maternal mortality rate is defined as the number of maternal death per 1 lakh live birth due to the pregnancy or the termination of the pregnancy, regardless of the site or duration of pregnancy. Okay. The maternal mortality rate is also used to represent what it represents, the risk associated with the pregnancy among the women. This we can identify the risk associated with the pregnancy among the women. Okay, next one is community. What is community? It is the important topic. What is community? Community is a social group whose members having something in common. If something in common, that we are known as community. Which all are common things? Shared government, geographical location, cultural and heritage. This all we having common things. They all are coming under the community peoples. Community can also refers to the physical location where such a group lives. It can refer to a town, city, village or other area with a formal government whose residents share a nationality or culture. As a group of town citizens decided to clean up the litter in their community. So this is known as community. Okay, next we can see that target couples. What is target couples? Eligible couples who having 2 or 3 living children. These formed a priority group among the eligible couples. Now, even couples with just 1 or newly married couples are also considered a priority for family planning. Those who having the priority to family plan, that we are known as target couples. Okay, next we can go for the health team. What is health team? And who all are the members coming under the health team? We can discuss. Okay, the health team have been defined as a group of people who share a common health goal. Let's see, who share a common health goal and common objectives determined by community need to the achievement of which each member of the team contribute in according to his or her competent and skill and in coordination with the function of others. Okay, next one, the members of the health team include all those who are working together for a common goal. Example, the supporting staffs like drivers or orderlies, kitchen staffs, cleaner. All of this is important. It is important that their work is contributing, be organized, as well as those of the technical staff like the doctor and the nurse. So mainly the health team come under the doctor and the nurse. One note is there, at some of the level the same people provide the services. Example, in community level. Okay, next we can see that occupational health. What do you mean by occupation? Those who are working, that is known as occupation. According these words were by the World Health Organization, WHO. Okay, occupational health deals with all aspects of health and safety in the workplace and has a strong focus on primary prevention hazards. Okay, the health of the workers has several determinants including risk factors at the workplace leading to cancer, accidents, musculoskeletal diseases, respiratory diseases, hearing loss, circulatory diseases, stress-related disorders and communicable disease and others. These all determinants were coming under the occupational health. So we are discussing about the occupational disease. Next we are discussing about the vital statistics. What is vital statistics? A vital statistics system is defined as the total process of collecting information. What is that? Collecting information by civil registration or enumeration of the frequency or occurrence of specified and defined vital events, as well as relevant characteristics of the event themselves and the person or the person considered. Okay, next one is compelling, progressing, analyzing, evaluation, presenting, dissemination these data in statistical form. The vital events of interest are live birth, adoption, recognition, death and fetal death, and marriages, divorces, separation and annulments of marriage. So this all are the vital statistics that we are collecting or collecting information. Okay, Next one, epidemiology. What is epidemiology? Epidemiology is a branch of medical science. It is a branch. One branch is for epidemiology that investigate all the factors that determine the presence or absence of disease and disorders. That we are in this one we are determining the presence or absence of disease and disorders. Since 1828, epidemiology is a branch of medical science that deals with the incidence, distribution and control of disease in a population. Okay, next we are moving for the 13th question. Who all are the eligible couples? Or what is eligible couples? A currently married couples wherein the wife is a reproductive age. The wife having reproductive age 15 to 49 years of age. Those who having get reproductive. So that we known as eligible couples. So approximately 150 to 180 eligible couples per 1,000 population in India. Okay, next we are moving for the national health planning. What is national health planning? The orderly process defining national health problems, identifying unmet needs, surviving the resource to meet them, and establishing the priority goals to accomplish the purpose of purposed programs. So this all are known as national health planning. Next one is handicap. We all know that who is handicapped and what is handicap. Handicap is a disadvantage for a given individual resulting from impairment or a disability. It is a disability which prevents the fulfillment of a role that is considered normal. Okay, here depending on age, sex, social and cultural factors for that individual. Okay, next we are moving for the fill in the blanks. So here we are completing the give the meaning. Next we are moving for the fill in the blanks. Okay, death occurring within 4 weeks or 28 days of birth are called as neonatal death. Neonatal death. Okay, the purpose of communication may be classified under the information, propaganda and dash, that is health education. This filling the blanks is very important, each mark having one. Okay, so next third one, district public health nurse will interrupt the needs of nursing and midwifery service to the dash and dash, that is Anganwadi workers and dayas. Okay, next one, sex education helps young people to shoulder the responsibility of marriage and reproduction. Okay, next one, health assistant male covers the population of dash to dash in each sub-centers, that is 5,000 to 8,000. Next one, BCG vaccine prevents tuberculosis. It is very important. We all know that BCG vaccine prevents that tuberculosis. Okay, moving to next slide. Dash refers to increase in physical size of the body. It is growth. It is growth only, increase the physical size of the body. Dash is the first step to the control the communicable disease, that is identification. Identification is the only and the first step in the control of communicable disease. Next one, the total fertility rate gives the appropriate magnitude of completed dash, that is family size. Okay, dash was the first state to set up separate section MCH in public health department, that is West Bengal. West Bengal is the state. Okay, next we are moving for the state whether true or false. So previously we discussed about the filling the blanks. Now we are discussing about the true or false. Okay, first one, the census is taken once in 10 years. That's true or false? It's true. Next, intrauterine devices is a permanent method of family planning in female. That is false. Next one, PHC covers primary health center. PHC means primary health center covers the population of 1 lakh in plain areas. That is false. Okay. Next one, the block consists of about 100 village. Only 100 village will be there in the block. No, it is false. Okay. Next, inhalation of silica dust causes silicosis. It's true. Inhalation of silica dust, it causes silicosis. Okay. Next, corporation in urban areas have a population of about 2 lakhs. That is true. Next, the road to health card is important tool for monitoring growth of under 5 children. It is true. Okay. Next, next one, 11th 5-year plan was started in the year of 2005. It is false. Next one, one sub-center covers 30,000 population in a plain areas. That is True. Next one, inhalation of grain dust causes farmer lung disease. It is true. Next one, the first census conducted in India in 1881. It is false. Next one, the MTP Act was passed in the year 1962. False. Actually, you want to know the which year, which all are done or which all are happens, you must know. Okay. Next one, the minimum need program was initiated during fifth year plan 1974 to 1978. That is true. Next one, record review method is secondary source of information. That is true. Next one, 100 Anganwadi workers work under the One Child Development Project Office. It is false. So here we are completing our true or false. Next we can go for the choose the best answer. Okay, first question. Rural health scheme is based on the principle of placing people's health in. So here the options is nurses hand, doctors hand, people's hand. So here the option 3, that is people's hand. Next, second one. Currently one third of the world's population is under the age of, here the options 5 years, 15 years and 25 years. So the answer is 5 years. Next, third one. It is an indicator of the prevalence of contraceptive practice in the community. So here the options fertility, couple protection rate and net reproductive rate. So here the answer is couple protection rate. Next one. Fourth one, modified leprosy elimination campaign was launched in the year. So here the options 1996, 1997, 1998. So here the answer is 1997. So you must know the years, date and everything. Okay. Next one, Montauk's test is done in. So here the options tuberculosis, malaria and AIDS. So here the answer is tuberculosis. Montauk's test is done for tuberculosis. BCG vaccine is done for tuberculosis. Okay. Next, permanent method of family planning is in male is dash, that is vasectomy. Here the options vasectomy. So permanent method of family planning in male is vasectomy. Okay. Male in vasectomy, tubectomy in females. Okay. Next one, sex ratio is defined as the number of female per 1000 males. So here the options 3000 males, 1000 males and 1500 males. So here the answer is 1000 males. Okay. Next, 8th question. Integrated Child Development Scheme ICDS program was launched in which date? Here the options 1983, 1975, 1902. So here the answer is 1975. Next one, World's Population Day is celebrated on. So here the options January 2, November 14th, July 11th. So here the answer is July 11th. Sorry. Next one, 10th one. Hib vaccine is used to prevent first one pertussis, second one hepatitis, third one meningitis. So here the answer is meningitis. So here we are completing our choose the best answer. Next we are moving for the write the short notes of the following. First one, functions of Union Ministry of Health and Family Welfare in India. So we having the functions. So here the functions one by one. Formulation of health policies. First step is for formulation of health policies. Prepare national health policies and programs for improving public health. Next one, implementation of first one, formulation of health policy. Second one, implementation of national health programs. Supervises programs like National Health Mission, AIDS control, immunization, etc. Next one, regulation of medical education. Controls standard of medical, dental, nursing and pharmacy education through bodies like NMC and INC. Okay. Next one, public health services. It's promote and manage preventive, promotive and curative. This one 3 is important. Preventive, promotive and curative health services across the country. Next one, family welfare. Implements family planning. Family welfare, we all know that it will implement the family planning, maternal and child health and reproductive health programs also. Next one, next function, international health relations. What is that? Coordinate with the WHO, UNICEF and other global health organization like that. International health relations they will maintain. Next one, Control of communicable disease. How we can control the communicable disease? What are the communicable diseases like TB, malaria, polio? And thus we can control the plans and executive disease prevention and eradication programs. Okay. Next, eighth one, health research. It promotes and funds medical and health research through ICMR and related institution. Next one, regulation of drugs and cosmetics. Ensure quality, safety and efficiency of medicines. What is that? Quality, safety and efficiency of medicines through the Drugs Controller General of India. Okay. Next one, 10th one, health awareness and education. 10th one, last function, health awareness and education, conducts health education and awareness campaigns for the public. So this all are the functions. Next question, levels of healthcare. So we having 3 levels. First one is we can tell that healthcare provide the 3 main levels, that are, first one is primary level, second secondary level, third tertiary level. So we can learn about the primary level. It is the first level. We all know that it is the first level of contact between people and the health system. People and the health system. Okay, this is the first level. Focuses on preventive, promotive and basic curative services. Okay, example, sub-centers, primary health centers, PHC. Okay, this all are the example. Then services include what all? The immunization will be there, antenatal care will be there, treatment of minor illness will be there, health education also we can in the services included. Next one is secondary level healthcare. This is second one. Then it provides specialized service that cannot be handled at the primary level. In the first primary level we can handle, in the secondary level only we can handle this all problems. Okay, include district hospital. It include district hospital, community health center, CHC, community health centers. It normally the second step. Okay, services include specialist consultation will be there, like medicine, surgery, pediatric and obstetrics, like this laboratory, diagnostic service, all were coming under the services, that is secondary level. Next we are moving for the tertiary level of the healthcare. What is that? It provides highly specialized and advanced care. It includes medical colleges and specialized hospital. In this, services include super specialty treatments like cardiology, neurology and oncology. It's something big than the other 2 sectors. Okay. Research and advanced diagnostics. So this all are the levels of healthcare. Next we are moving for the 3 levels of healthcare of mentally challenged in the community. Here also we can see that 3 levels of healthcare. The first is primary level, second secondary level, third one tertiary level. Okay, we can see the primary level. Sorry. Okay, primary level. Early identification and referral of mentally challenged person. Second point, basic counseling and health education of the family members, conducting awareness program to reduce stigma. Next one, provided through sub-centers and primary health centers, PHC, by community health workers, ANMs and nurses. So this all are under the primary level. Next we are discussing about the secondary level, diagnosis and treatment of mild to moderate mental disorders. Psychological counseling will be there, occupational therapy will be there and rehabilitation services also will be there. It conducted in district hospitals or community mental health centers with the help of psychiatrists and psychologists. Okay, next we are moving for the third one, in the last level of the healthcare of mentally challenged in the community, that is tertiary level. What is that? Care for severe and chronic mental illness. Okay, specialized treatment, long-term rehabilitation will be there and research also will be there, provided by mental hospital psychiatric units in medical colleges and national institute like NIMHANS. Okay, so this all are under the tertiary levels. Next we are moving for the 4th question, prevention and control of vitamin A deficiency. Vitamin A. So here we can see that 4 points, that is first one, promotion of breastfeeding. That is, encourage exclusive breastfeeding for the first 6 months of life, since the breast milk rich in vitamin A. So vitamin A contain rich breast milk having rich vitamin A. Okay, next one, vitamin A supplementation. Administer vitamin A prophylaxis to the children under the national prophylaxis program. First dose will be 1 lakh 1 YU at 9 months with meals vaccine. Next dose will be 2 lakh 2 lakh IU every month 6 months up to 5 years of age. Next one, third one, dietary improvement, that is encourage consumption of vitamin A rich food like animal source and plant source. Animal source will be liver, milk, egg, yolk, fish. You can write to yourself only. Then plant, you can see that green leafy vegetables, carrot, pumpkin, papaya and mango. Okay, next one, health education. We want to give health education. Educate the mother and community about the importance of vitamin A rich diet and a regular supplements. Okay, so this all we can see. Then the last one more point is there, control of infection, that is prevent and treat infections like measles and diarrhea. These are the infections that we got, measles and diarrhea, that can worsen vitamin A deficiency. If vitamin A deficiency will be there, the solar infection we will get. Okay, next, fifth one, village health guides, VHGS. What is that definition? Village health guides are trained community health workers selected from the village to provide basic health care services to the people in rural areas. In the rural areas, the trained community health workers will be there. So in the selected from the village, that we known as village health guides. Then we want to give the training for them. Give training for 3 months in the basic health care, first aid, maternal and child health and the disease prevention. Next, what are the functions? First point, provide the first aid and treat mirror ailment. Next one, assist in immunization and family welfare programs. Educate the people on hygiene, sanitation and nutrition. Thus guides want to teach them, educate people on hygiene, sanitation and nutrition. Next one, help in early detection and referral of serious cases of health centers. Next one, motivate people for institutional deliveries and immunization. Next one, what is the role? It is the act as a link between the community and health services. Next one, remuneration. What is that? They will receive a small honorarium or incentive for their work from the government. They get a small salary from that. So this all are about that the previous question. Next one, sixth one, importance of health statistics. What is that? Planning and policy making. Importance of health statistics. First one, health statistics help governments and organizations plan health programs and allocate resources effectively. Next one, monitoring and evaluation. We want to monitor and evaluate. What is that? Used to monitor health trends, assess the progress of health programs and evaluate their impact. Next one, disease prevention and control. In that we can write that helps identify disease patterns, outbreaks and high-risk population for timely intervention. Next one, research and evidence-based decisions. What is that? Provides data for medical research, public health studies and evidence-based decision making. Okay, next one, resource allocation. Resource allocation means helps in distributing medical resources, manpower and funding where it's most needed. Okay, next one, international comparison. What is that? Enable comparison of health indicators with other regions or countries for better policy formation. That is international comparison. Next one, public awareness. We want to give a public awareness. What is that? Data can be used to educate the public about health risk and promote healthy behaviors. Okay, next, functions of health assistant. What is functions of health assistant? So we can know that the functions. Okay, so here we are discussing in the males. Okay, health statistics help governments and organizations plan health programs and allocate resource effectively. First one, primary health services that provide first aid and basic treatment for minor illness and injuries. Second one, assist in immunization and vaccination programs. Second one, maternal and child health. What is maternal and child health? As in maternally, how we will assist, that is assist the antenatal and postnatal care should be given, helps in the family planning services and health education for the mothers. Okay. Next, health education and promotion. How we will do the health education? Educate the community about hygiene, sanitation, nutrition, disease prevention. This all we want to educate. What all that? Hygiene, sanitation, nutrition and disease prevention. Okay. Next, disease control programs. How we will educate disease control programs, how we will participate in the control of communicable disease like malaria, tuberculosis and leprosy. Okay, this all communicable disease we can participate in the control for control this communicable disease. Next, conduct health surveys and screening in the community. Conduct health surveys, we can conduct health surveys. Okay, so this all the disease control programs. Next one, community mobilization. How we will community mobilize? Okay, this act as a link between the community and health facilities. It motivates people to use health service and participate in national programs. Next, sixth one, record keeping and reporting. Record keeping, it maintains health records, reports statistics of the village or the area assigned. So this all are the record keeping and the reporting we will do. So here we are completing that importance. Next we are functions. Next we are discussing about the school health committee. What is the school health committee? We in our schools also we having this school health committee. Okay, a school health committee is a group of school that works to promote health, hygiene and the safety among the students and staff. So this health committee, that is a group of school that promote the health, hygiene and the safety among not only the students, it's also for the staff. Okay. Next one is objectives. What are the objectives under the school health committee? First one, monitor the student health and nutrition. We are only discussing that the committee is to promote the health. So here, of course, monitor the students health and nutrition. Next one, promote cleanliness and hygiene in a school. It should be maintained. Okay, next one, conduct health checkups and vaccination drives. Okay, that should be done, and provide health education of nutrition, exercise and disease prevention. Next, last one, coordinate with parents and local health authorities for the support. Okay, next one, members typically include. Who all are the members included? That is principal and the head of the school, teachers will be there, school nurses or health worker will be there, parent representative will be there, student representative will be there. Then the school health committee ensures that the school environment is safe, healthy and supportive for learning and growth. Okay, so this all are the under the school committee health. Okay, next one is ninth one, national health policy. What is that? Here a very simple version of national health policy. So a plan by the government to improve the health of all people. Next one, ensure everyone gets basic health care at the low cost. This is the important one. Next one, focus on prevention of disease, health promotion and treatment. Next one, strengthens the hospital, doctors, nurses and health cares. Next one, promotes maternal and child health, nutrition and hygiene. Last one, use technology and partnership for better health services. So this all are the national health policies. You can write your own words or you can explain one by one. Okay, so next one is 10th one, district health system. Now we are discussed so many of things. Last we were discussing about the district, how we were controlling the health system in district. Okay, district level head, district health officer will be there, chief medical officer will be there, who is that in charge of all health activities in the district. So this two members, this or this, who is the charge of all health activities in the district. Now we can see the health faculties. Okay, who are the, sorry, it's not faculties, it is facilities. Okay, health facilities. What is that? District hospital, community health center, CHC, PHC and sub-centers. Now we can discuss one by one. First one is district hospital, main hospital with specialist and advanced care. Next one is community health care, CHC, that is secondary care for towns and large villages. So next one, PHC, normal PHC we all are went. Okay, PHC health centers, basic health care for smaller areas. Next one, sub-centers. What is that? It is the first contact point, focuses on preventive care and health education. Next one, support staff and programs. What is that? Nurses, ANMs, male health workers. We want to support the staffs and programs. Okay, program officers for immunization, TB, malaria, family planning, etc. Okay, next one, coordination. Coordination must be there for the health system. Coordination works with local government and NGOs to reach the community. So, here we are completing our short answers. Next we are moving for the long essay. Okay, are you guys tired? No problem. Or after this long essay we will finish it off. Okay, write the long essay of the following. I will do the dictation. Okay, first one, define MCH. A question and a B question. Goals to be achieved by 2010 MCH goals. Okay. So here the A question, what is define MCH. MCH is the maternal and child health that refers to the health services, programs and strategies aimed at promoting the well-being of mothers, infants and children. It focuses on reducing maternal and child mortality, ensuring the safe pregnancy and childbirth, promoting proper nutrition, immunization, overall development of the children. What is this MCH? MCH is mean maternal and child health. It refers the health services that being given to that mother and the child for their health. For what all are we want to give? That well-being of the mothers or infants, children. In this all we were giving that health. It focuses mainly what all we are focusing. Mother safety, we will ensure that a safe pregnancy, childbirth, promoting the proper nutrition. We are giving proper nutrition to the mother or the child. Immunization should be given. Overall development of the children. Overall development of the children, all we are under that MCH, maternal and child health. Next, B, goals to be achieved in 2010. What all are the goals that we are achieved in MCH? Okay, globally the MCH goals were aligned with the Millennium Development Goals, which include first one, reduce maternal mortality. It will reduce maternal mortality. Lower the number of women dying due to the pregnancy related issues. It is the good thing. Okay, reducing the maternal mortality rates. If the mother is dying in their pregnancy time, means it is very sad news. That is reducing maternal mortality, lower the number of women dying due to the pregnancy related causes. Next one, reduce child mortality. What is child mortality? Child also getting death. Okay, lower the death rate among the children under the 5 years of age. 5 years of age. In between the 5 years, this children's were got death. Okay, next one, improve the reproductive health. Ensure the access to family planning, prenatal care. So improve the reproductive health. So this all are coming under the first question, MCH. Okay, next it's actually the long essay. You want to maintain your own notes with some more additional points. Okay, next we are discussing about the second question, name of sexually transmitted disease, STDs. Second one, role of nurses in STD management, sexually transmitted disease. Okay, first one, what is name the sexually transmitted disease. Okay, sexually transmitted disease are the infection transmitted primarily through the sexual contact. For the sexual contact only, the sexual infections like that we were discussing. What all that? Bacterial STDs will be there. That is gonorrhea, syphilis, chlamydia and cancer. Okay, next viral STDs will be there. That is human immunodeficiency virus. That is HIV acquired immunodeficiency syndrome. Genital herpes will be there. Human papilloma virus, HPV, genital warts and hepatitis B, sexually transmitted form. These all are the viral and bacterial STDs, sexually transmitted diseases. Then one more there, parasitic will be there, and the fungal also will be there. Okay, the third one is parasitic STDs, that is trichomoniasis. Okay, next the fungal tinnitus. Okay, this is all the name of the sexually transmitted disease. Next one, be role of the nurse in STD management. What is the role of the nurse? Nurses play a crucial role in the prevention, diagnosis, treatment and counseling of patients with STDs. Their responsibility includes health education and awareness. They want to give a health education and awareness. Okay, this all are coming under the sexually transmitted diseases and the management. Okay, management you should write your own way. Okay, health education and awareness should be given, and some other points you can add. Okay, next the third one. What is ICDS scheme? What are the objective of ICDS scheme? Strategies adopted to achieve the objective. So we can move for the first two steps. What is ICDS scheme? ICDS means Integrated Child Development Services. It is a flagship program of the Government of India launched in 1975. The date is 1975. Please note the dates because it will ask for the choose the best answer. Okay, to improve the health, nutrition and development of the children below 6 years of age and their mothers. So this all are the ICDS. What is ICDS? Then it is a convergent scheme that provides nutrition, health and early childhood education through a network of Anganwadi centers. So it convergent the scheme that provide what is that nutrition, health and early childhood education through the network of Anganwadi centers. So this all are the what is the ICDS scheme answer. Okay, next we were discussing about the here the supplementary nutrition will be there, providing nutritious food to children, pregnant women and lactating mothers. Supplementary nutrition should be given. Then health checkups should be given. Regular medical checkups and referral services also given for the health checkups. Next one is immunization, ensuring children are vaccinated as per as national guidelines. So that is immunization. So this is the 3 steps. Next one is fourth one, health and nutritional education, educating mothers on child care, feeding and hygiene, preschool education, that is early childhood care and education for children aged 3 to 6 years. So here we completing what is ICDS scheme. Next we are discussing about the main objectives of the ICDS program. What is that? Here the 7 objectives will be there. We can discuss one by one. Okay, first one, improve nutritional and health status of children below 6 years. Below 6 years, we want to improve the nutritional and health status of children. Next one, reduce infants and child mortality, morbidity and malnutrition. Okay, next one, lay the foundation for proper psychological, physical and social development of children. We should foundation the proper psychological, physical and social development of the children. We must foundation of the proper psychological, physical and social development of the children. This is the third objective. Next one, improve, fourth one, improve the health and nutritional status of pregnant women and lactating mothers. Okay, improve the health and nutritional status. We want to improve the health and nutritional status of pregnant women and the lactating mothers. Next, fifth one, increase awareness among the mothers about the health, nutrition and child care. What is that? Health, nutrition and child care. Increase the awareness. Next, sixth one, enhance the ability of mothers to provide proper care to their children. So we want to enhance the ability of mothers to provide proper care of their children. Next, seventh one, provide early childhood education to prepare children for formal schooling. Formal schooling, we want to provide early childhood education. We want to give a childhood education to prepare children for formal schooling. So this all are the objectives of ICDS. Next, the C question, strategies adopted to achieve the objectives. What are the strategies? So here we can see, to meet the ICDS objectives, the following strategies are adopted. So here we can see that first one, Anganwadi centers will be there, supplementary nutrition programs will be there, health service integration will be there, nutrition and health education will be there, community participation, early childhood education and monitoring evaluation. So here we can discuss one by one. Okay. First one is Anganwadi centers. What is that? Functional centers at the village level provide services such as nutrition, preschool education and health checkups, that is Anganwadi centers. Next one, supplementary nutritional program, that we were giving supplementary nutrition to the children. Provide take home rations or hot cooked meals to children, pregnant women and lactating mother to combat malnutrition. Next one, health service integration. What is that? Coming under collaboration with health department for immunization, regular health checkups and referral services. Next, fourth one, nutrition and health education. Educate mothers and communities about proper feeding practice, hygiene, sanitation and preventive health care. Next one, community participation. Community participation should be needed. What is that? Encourage women self-help groups, local leaders and mother community to participate in program planning and monitoring early childhood education. Early childhood education means provide non-formal preschool education to children aged 3 to 6 years to enhance cognitive and social development. For the children's cognitive and social development, we should provide the normal non-formal preschool education should be given for the 3 to 6 years of the children. Next one, monitoring and evaluation. Last step is monitoring and evaluation. What is that? Regular supervision, record keeping and evaluation to ensure the services reach the targeted beneficiaries effectively. What is that? Regular supervision. Supervision should be there. That is record keeping and evaluation. Keep on evaluating to ensure services reach the targeted beneficiary effectively. So this all are the slides we are go through. First one we discussed about the meanings. Next we discussed about the filling the blanks, true or false, choose the best answer. Next the short answers. Then last one is we are discussed about long essay. Hope you got a good marks in the exams. Anyway, all the best. Thank you and have a nice day.